now we're doing the muscles on the posterior side for the torso. So the first one you're gonna do is the rectus spinae groups. I know that's not one muscle, so it's three. So in a nutshell, the way those run, right, to find the spinalis, it's gonna run right along the spine, just like the name would make you think. So it's gonna run right along, basically the whole way up, right? So you have that one there. And then we have the iliocostalis, so that's gonna, ilio, right? So that's gonna be that kind of posterior iliac crest, and it's gonna come up and it's gonna attach there on the ribs, right? Because it's costalis, costals are gonna be ribs. So it's gonna come up and kind of spread out and attach various places there on the ribs. And then we have the longissimus. So that one's gonna be the one that comes all the way up. They kind of sit, kind of work their way out. Longissimus is gonna come up and it's gonna attach to that mastoid process. That's that bump there behind the ear. So it's the long one that comes the whole way. So as a group, they're gonna kind of come from that posterior iliac crest, the sacrum. They're gonna attach on the lumbar vertebrae, and the last couple thoracic vertebrae. That's all origin, and then insertion is going to vary from like the posterior ribs. You have the transverse and spinous processes on the thoracic and the cervical vertebrae, and then like I said, up to that mastoid process. So it kind of spreads out. Now remember, all of those are deep, right? Because remember, we have that latissimus dorsi out here, we have the trap up here. So as we work our way down the spine, we have, like say if we're up here at the top part, you have your trapezius, and then you have your rhomboids, and then you have, the serratus posterior superior, right? It's going to be up there. So this is kind of a deep, these are deeper muscles. So you're kind of going to the space where they are. Now, if you do want to try to locate a little bit of that, what you'd have her do is if she extends her back from this position, so kind of if I hold her leg down and she extends, so you can see those erector spinae muscles just pop out right there really well. So that's a nice, easy way to kind of find them and give you an idea landmark wise. Right, so that's that group of muscles. Now we do have, we're gonna really spend a lot of time on them as far as in the video, so you guys can look at them through the book and things. So anything that says capitis is gonna attach at the head. Anything that says cervicus is gonna attach at the cervical spine. Thoracic is gonna attach in the thoracic. So they kind of work their way up and they're gonna run along. Now the other thing that we have that runs along the spine, it's going to be in that lamina groove. So remember, the lamina groove is going to be that spinous process, and it's the groove next to it, right between the spinous process and the transverse process. So it just sits in there really deep. So we have the multifidi, and then we have the rotators, right? So those are going to run right along basically the entire length of the spine. So the multifidi are going to span 2 to 4 vertebrae, and the rotator is 1 to 2, right? So they're not very big muscles, and they're just kind of running all the way up along through here. So that's the other ones that are there that we're going to talk about. Now we're going to move to the abdominal muscles, which is part of the thoracic cavity or thoracic area and abdominal area muscles. So the first one we're going to do is kind of our abdominal muscle that's on the posterior side. So it's that quadratus lumborum. So it's going to sit if we go between the 12th rib and the iliac crest, that kind of softer space here on the backside. So it's where that quadratus lumborum is going to sit. It kind of takes up this space right here. So it's going to attach at the posterior iliac crest and come up to the last rib, and as well as the lumbar vertebrae on the transverse process. So it's kind of filling in that space right there on the posterior side. Now, if we flip over, we have muscles that everybody knows on the abdomen, right? So first we have the external oblique. So the external oblique is going to come from the ribs, and it's going to come down and attach at the iliac crest, right? So it's going to kind of come this space here. It's on the external surface of the rib, so it kind of lays over the top. So it attaches those, and also attaches at the rectus sheath, or rectus abdominis sheath, and the linea alba. So linea alba, if you think about that six-pack, that line that runs right down the middle, that's that linea alba. So they all hold on out there in order to hold the contents in. So that's all your abdominal muscles. That's one of their jobs, is to hold things in. So that's the external oblique. Now the internal oblique is going to kind of come from, so I'll reach to this side. So it's going to come from back here and work its way around. So it's that lateral inguinal ligament, iliac crest, and that thoracondylar fascia there at the back. And it comes up to the internal surface of the last few ribs. So it's coming kind of this way and attaching. So that's the internal external oblique. And then next you have the rectus abdominis. So that's the one that everybody knows. And that's the big abdominal muscle that runs right here in the middle. That's our six-pack, right? That's there. Now that one's going to come, a lot of people don't realize, it actually attaches at the pubic crest and pubic symphysis. So it's going to attach low for the origin, and then the insertion is going to be that xiphoid process, and then this cartilage here at the 5th, 6th, and 7th rib. right where you would think it runs, right? So if we do a crunch, you think about where that muscle is. So it does take up that space. Then the last abdominal muscle, the one everybody forgets about, is the transverse abdominis. So it's going to sit deep and it kind of runs across this way. Its only job is to hold contents in. So you're not using that one when you're in the gym, right? But if you've ever done anything in the gym where you suck in your gut, that's your transverse abdominis, holding things in. So anyway, it's also attached to that linea alba there at the middle and help hold everything in. That's it.